What inspired you to pursue a career as a personal care assistant?
I have always had a passion for helping others, especially those who are elderly or have disabilities. Becoming a PCA allows me to provide meaningful support to individuals and make a positive impact on their lives. I find it very fulfilling to assist people in maintaining their independence while ensuring their comfort and well-being.
What skills do you have that make you a good fit for this role?
I am compassionate, patient, and attentive to the needs of others. I have excellent communication skills, am well organized, and have the ability to handle difficult situations calmly. I am also trained in basic caregiving skills, including mobility assistance, medication reminders, and personal hygiene care.
How do you ensure the safety and comfort of your clients?
I always assess the environment to ensure there are no hazards, such as loose rugs or clutter, and take steps to prevent falls or injuries. I also make sure to listen carefully to any concerns the client may have and adapt my care based on their specific needs.
Can you describe a time when you had to deal with a difficult client? How did you handle the situation?
I had a client who was initially resistant to receiving help. I took the time to understand their concerns and explained how my assistance could help them maintain their independence. Over time, I built trust, and they became more comfortable with receiving help.
How do you handle a situation where a client refuses to take their medication or follow their care plan?
I would first try to understand why the client is refusing and address their concerns with patience and empathy. If the issue persists, I would involve the appropriate medical professionals and communicate with the family members to ensure the client receives the best possible care.
What are your qualifications for this role?
I have completed a PCA training program and am certified in CPR and first aid. I also have experience working in caregiving roles, where I assisted with daily living activities, mobility, and personal hygiene.
How do you manage your time when assisting multiple clients in a day?
I prioritize tasks based on urgency and importance, ensuring that I allocate sufficient time for each client. I also keep a schedule to help stay organized and make sure I am on time for each appointment.
What steps do you take to maintain confidentiality and respect client privacy?
I always make sure to follow HIPAA regulations and respect client privacy at all times. I avoid discussing personal information about clients with others unless it's necessary for their care. I also ensure that any documentation is stored securely.
How do you handle emotional stress while caring for clients?
I recognize the importance of self-care and take time for myself outside of work to recharge. I also seek support from coworkers or supervisors if I need guidance on handling challenging emotional situations.
Describe a time when you went above and beyond to help a client.
I once helped a client celebrate their 80th birthday by organizing a small surprise party. It wasn't part of my duties, but I knew it would bring them joy, and I felt it was a meaningful way to make their day special.
How do you ensure that you are providing personalized care for each client?
I make sure to understand each client's unique preferences, needs, and routines. I keep track of any changes and communicate with their family or healthcare providers to ensure the care I provide is tailored to their individual requirements.
What would you do if a client experiences a fall or injury?
If a client falls or is injured, I would immediately assess the situation and ensure they are safe. I would provide first aid if needed and call emergency services if the injury is severe. I would also report the incident to my supervisor and document it accurately.
How do you maintain a positive relationship with your clients and their families?
I maintain open communication with both clients and their families. I listen to their concerns, provide updates on the client's condition, and ensure that I am fulfilling the care plan as agreed upon. Building trust and showing empathy are key to developing positive relationships.
What is your experience with mobility assistance or transfers?
I am trained in proper body mechanics and use safe lifting techniques to assist clients with mobility. I ensure that I have the necessary equipment, like transfer belts or lifts, to provide support during transfers while prioritizing the client's comfort and safety.
How do you handle a situation where a client is upset or agitated?
I stay calm and listen to their concerns. I try to validate their feelings and find out what might be causing their distress. If necessary, I would provide reassurance or use calming techniques to help them relax.
What is your approach to working with clients who have dementia or Alzheimer's disease?
I approach clients with dementia or Alzheimer's with patience and understanding. I use simple language, avoid confrontation, and maintain a calm and reassuring presence. I also follow strategies to promote their memory and help them feel engaged.
How do you stay organized when managing a client's care plan and appointments?
I use a combination of digital tools and written notes to keep track of clients, schedules, care plans, and appointments. I review the care plan regularly to ensure I am meeting all the necessary tasks and making adjustments as needed.
How would you handle a situation where a client requires additional care outside of your duties?
I would notify my supervisor or the appropriate team member to ensure the client gets the necessary care. If the situation requires immediate attention, I would assist to the best of my ability while waiting for additional help to arrive.
What do you enjoy most about being a personal care assistant?
I enjoy making a difference in someone's life, whether it's through a simple act of kindness or providing assistance with their daily activities. Seeing my clients maintain their independence and live comfortably is what motivates me.
What are your long-term career goals as a personal care assistant?
In the future, I hope to continue expanding my knowledge through additional training, especially in areas like geriatric care or specialized health conditions. I also aspire to take on leadership roles, such as a supervisor or mentor, to guide other PCAs.